Well, this is a chance to take a second shot on goal. We had intended to show some cases as part of yesterday evening's cocktail seminar, but after a few too many cocktails, we decided to stop the program early. And we do hope that as the crowd comes in, we'll be able to share some ideas. But the the conversation will be centered around two things. One is sort of a portfolio of trials that are being done with a sirolimus coated balloon called the Magic Touch. And the other will be to show some cases that are some novel applications of a below the knee treatment with a sirolimus coated balloon that you've heard a lot about. My relevant disclosures that I'm a study chairman for one of the trials with Concept Medical. But you've heard earlier that it's been difficult to get sirolimus to be on a balloon and then deliver to an artery with adequate tissue level concentrations. I spoke about that some yesterday, and I spent the better part of my academic life for the last 30 years, believe it or not, looking at local vascular drug delivery. And the idea that we can get sirolimus to bind with a high enough avidity to have therapeutic concentrations in the artery has been a dream for a long time, and it was easily achieved with permanent indwelling stents, but difficult with drug-coated balloons until recently. And there have been several approaches. Eric Sisemski gave a great talk this morning about some of the technologies, but I'll just highlight that the Concept Medical approach is to use a nanoparticle with a phospholipid drug carrier that encapsulates the drug, which is, as you know, a large molecular weight hydrophobic compound, and then to coat those nanoparticles on a balloon to develop a phospholipid layer outside of the balloon catheter. And this is their so-called nanolute technology. Without getting into the details of it, the balloon is inflated, is then spray coated, and then it's appropriately folded so that you have adequate drug around the circumference of the balloon. And this is how uniform the coating looks at a microscopic level. And when magged up even further, you can see that it has this sort of semi-porous structure that allows for effective drug transfer into the very deepest levels of the vessel. So the Concept Medical portfolio of treatments includes drug-eluting stents, but really we're going to talk predominantly about their coated balloons for the next few minutes. They're just so that you're aware, with respect to the newer technologies emerging, they're being applied broadly throughout the circulation, but in the coronary circulation, as you can see, the Magic Touch has a breathtaking number of studies that are either ongoing or completed. These happen to be completed and are in follow-up phase. These are in an ongoing phase, including, I might add, an in-stent restenosis trial for an IDE indication here in the United States that's led by my partner, Ajay Kirtane, at Columbia Medical Center. And this is a single-arm ISR study. And importantly, there will also be a very large 1,600 patient small vessel IDE that will be ongoing, hopefully in the next year. So in the coronary circulation, this device is going to be used here in the US. This is what's going on in the peripheral circulation. You heard from Eric earlier about the ecstasy trial, and the data from Eddie Choke in Singapore has really been the pioneer. They have a much larger randomized trial going on now. And I would highlight the Sirona trial, which is a RCT 1-to-1 randomization between sirolimus coated balloon to paclitaxel coated balloons for SFA disease that will be reading out hopefully sometime next year. It's really like a pivotal trial for sirolimus coated balloons in the SFA, and it's the furthest along of all the programs. We are privileged to be leading the magical below the knee and SFA trials here in the United States. Principal investigators are Brian DiRobertis and Eric Sisemski, and I'm the study chairman for those trials. And we're looking forward to getting these off the ground in the very near future, hopefully within the next quarter. And we have a superb set of investigators looking at it. There's also AV fistulae programs and for erectile dysfunction as well outside the US. So because this is an investigational product in the United States, I don't have any cases that I can show you. However, I've taken the liberty of borrowing a couple of important cases from Eddie Choke, who's been really one of the leaders in this space. And there are 2 points that Eddie likes to make about this device. One is that with most coated balloons, there is a particulate embolization. And with that is a frequently associated but very seldom talked about no reflow or no slow flow phenomenon. And so Eddie actually has looked in the literature, and the slow flow phenomenon is quite commonly observed in DCBs, upwards of 8% in most series. And the significance is that, like no reflow in the coronary, it portends a poor prognosis. It increases restenosis and TLR and worsens amputation-free survival. And so here's a case. This is a case from Eddie. You can see him down here. He's the live case operator in this case. 76-year-old man with hypertension, tobacco user with critical limb ischemia, as you can see with a malformed foot. There's only a perineal reconstituting a distal posterior tibial artery. In this case, they could not cross antegrade in either the PT or AT, and we're hoping to do a transcollateral or a direct puncture retrograde PTA. So they do access the posterior tibial, they do cross retrograde, they reverse the system and cross the pedal loop, and then cross the anterior tibial retrograde. All of which I think is cool, until you realize that this is a drug-coated balloon. This device has the deliverability to go across the pedal loop, and they can actually, you can see from working from the PT around the loop to the AT, they're able to do a DCB inflation with a 2.5 balloon around the entire pedal loop. Not something that you might be able to do with what we see contemporary technologies. They subsequently complete by treating the AT in a retrograde fashion, and thereafter they do larger DCBs up top. And here is your final angiographic result, where you now have competing flow coming down the AT and the PT with a drug delivery technology used essentially throughout the entire intervention. Very cool. Here's a second case, patient with gangrene, has an extensive amputation, and this is his angiography. Moth-eaten disease in the PT, and sequential subtotal and/or total occlusions. And again, you'll see this is a sort of a day in the life of a CLI operator with diffuse disease and an incomplete pedal loop. This is the post-surgical intervention. Here's again, I think that it's obviously sped up a little bit, but this is wiring of the loop. Another example of Magic Touch PTA around the loop, which again, I think if you've tried to deliver equipment around the loop, it's hard to imagine getting contemporary DCBs in this location. And then here's your baseline, and then your post-POBA, and there's no slow flow, which is another thing you'd be concerned about if you had particulate embolization in the loop into the digital arteries. Again, here's the pre and the post, just for reference. One other case that I think is particularly interesting is a patient, not shockingly in the Asia Pacific market, there's a higher incidence of vasculitides. This is a 37-year-old woman for whom they used a sirolimus coated balloon for vasculitis. This patient who had PAN, followed by a host of agents, including methotrexate, Cytoxan, Rituxan, another anti-TNF infusion, steroids, and antiplatelet and anticoagulant therapies. And she kept coming back with recurrent ischemia and critical limb ischemia. You can see that this is hers. This is one of Eddie's hallmarks. This is what they put in the chart with these cartoons of her sequential Doppler and then reinterventions. And this is what her foot looked like in August of 21, at which point they performed a biopsy of the dorsum of the foot, and they found a perivascular infiltrate with neutrophils and lymphocytes. This is dredging up the bones for most of us, but this is the pathology. And one of the interesting properties of sirolimus, lest we forget, is that it is an anti-immune drug frequently used in transplant allograft vasculopathy, and particularly in renal transplant. And so here, using a sirolimus-coated balloon, they were able to restore flow with the Magic Touch and have sequential healing. And here's sort of the timeline. This is before she had multiple repeat procedures. This was her toe pressures. And then she has her intervention with a Magic Touch and basically maintains a toe pressure above 60 subsequently, indefinitely. and has limb salvage. Unfortunately, the contralateral side was not so lucky, and she's needed further treatment. So yet another application of a sirolimus coated balloon, albeit a niche application. Certainly something to look forward to. So to summarize again, the Magic Touch Sirolimus coated balloon has had significant benefit in a wide variety of circulatory beds. It's ongoing IDE approval here in the United States for both coronary in-stent restenosis and de novo disease, as well as both SFA and infrapopliteal disease. There's a number of trials that will be ongoing in the not too distant future, and there will be additional trials for AV fistulae and for erectile dysfunction outside the United States, where it's already actively in use both in Europe and Asia. I think the clinical trial programs demonstrates a strong commitment with thousands of patients enrolled in a variety of pivotal trials, and we're excited to be part of this program. Thanks very much.